There's no question right now that cancer immunotherapy is a game changer. It has transformed the way we practice oncology, but it's also very deeply beginning to affect the way we are practicing cancer pathology. So we already have several markers that are, if you want, bread and butter for the therapeutic decision making in many of our cancers. The scoring of CD3 and CD8 in colorectal cancer, or for instance, the scoring of PD-L1 as an immunohistochemistry marker in several cancer types. So these are markers that have sometimes the capacity of prognosticate much better. For instance, immunoscore in stage 2 or stage 3 colorectal cancer, but sometimes are helping the oncologist to decide on a very specific therapeutic intervention. And obviously PD-L1 today is the paradigm in this context. So obviously it's early days in immunotherapy, so we are beginning to see the promise, but I'm sure we are going to begin to see very soon also its potential shortcomings. There is no question that immunotherapy today is providing long, sustainable outcomes in patients and in stages of cancer where we have never seen before. So obviously it's a significant way forward. However, it's not working in all cancers. It's always working in a specific selection of cancers, and that's why, in my opinion, defining the biomarkers that are associated with that therapeutic response is probably going to be one of our most important tasks in the next few years. So not only the potential therapeutic response, but also to be able to predict which patients are going to be selected for this new therapy. So it's very difficult to think today of a novel drug which is not associated with a biomarker. So trying to predict from a biological point of view and from the point of view of a test which patients are going to benefit from a drug is probably the paradigm that many agencies and many companies are looking for. So because of that, trying to understand in the context of immunotherapy what is the immune contexture of the cancers that are going to be treated seems like an essential task. And some of the results that we are presenting today are very early steps to try to define that in a holistic clinical context.